Hello everyone, I am Woodway, an acupuncture researcher. Recently, NBC reported that, for some long COVID patients, acupuncture and other Eastern remedies bring relief that Western medicines have not. This brings hope to patients who have tried all kinds of medical treatments but get no improvement. But not everyone can afford the cost of acupuncture. Today's program introduces to friends who do not have medical insurance and income how to give themselves acupuncture at home to relieve some of the symptoms of long COVID. The target audience of this program is those who are relatively young and have no other underlying diseases. After watching this program and receiving acupuncture, there is a certain probability that their symptoms such as fatigue, depression, loss of appetite, insomnia, night sweats, dizziness, nausea, palpitations, migraine, etc. can be relieved. If they can regain the ability to work, then they may be able to afford the fee for acupuncturist in the future. Before we proceed, it is necessary to emphasize a few points. 1. Only the limbs can be needled. Needling on the trunk, such as the abdomen or back, may pierce the internal organs and cause fatal consequences. 2. After acupuncture, all used needles must be collected and properly disposed of as medical waste. Leaving needles on the body or in the bed may cause fatal consequences to yourself or others. 3. Needle fainting may occur during acupuncture, so it is best to have someone else by your side to assist in removing the needles when necessary. 4. Do not acupuncture when you are drunk, hungry, too tired, too weak, or have a drastic emotional fluctuation. In order to do acupuncture at home, you need to learn two things. The first one is how to insert a needle. The second one is where to insert the needles. Now let's start from the first one, how to insert a needle. First disinfect the skin, then remove the fixing piece in the acupuncture needle tube, and then put the tube and needle on your skin, press at the end of the needle, and the needle will penetrate the skin. As long as you press fast enough, there is basically no pain. What if there is no family member to help you insert the needle, and you are very afraid of needles and dare not do it yourself? You can find something to bite, such as the metal sheet of a mobile phone charger, and then move the charger till it's on the needle. Hold on, till you can't hold anymore, the charger will fall on the needle, that's all. This process will be quick and you will not feel any pain. After the needle is inserted, you can slowly twist the needle to insert it deeper. If you feel pain when the needle touches blood vessels or nerves, you can pull the needle out a little bit, change the direction and insert it again. Move on till the needle reaches the specified depth. Note that the depth specified is different for each acupoint. Also note that the length and depth unit used in acupuncture is cui. The length of one cui is different for different people. Generally, the distance between the two ends of the transverse crease of the middle section of the middle finger is used as 1 cui. However, sometimes another definition of cui is used to determine the location of acupoints, but we will not use that kind of length definition, so we won't go into details here. After all the needles are inserted, leave them there for 30 to 40 minutes. Then you can remove them. Removing the needle is simple, just pull it out. If you feel pain, you can twist it and then try again. When practicing, pay attention to the resistance when inserting and removing the needle. If there is no resistance, it means that the insertion place may not be accurate enough or the qi is too weak, and the effect may be poor. On the contrary, slight resistance means that the position is correct and the effect will be good. In addition, when taking out a needle, if blood follows, you need not press the hole, but should rather let blood come out to remove blood stasis. The second question is where to insert needles. In acupuncture, we insert needles on acupoints, which are import points in meridians. Because this program deals with long COVID, we mainly introduce the damage to the meridians by COVID-19. Our past measurement results showed that about 30% of all persons had potential hand or foot Shaoyang meridian damage. The existing experience in treating long COVID also shows that the coronavirus mainly damages the lung and hand or foot Shaoyang meridians of a patient. If treatment is not done in time, it will further damage the liver and spleen meridians, or damage the hand or foot Yangming meridian. Since injuries to the lung and Yangming meridian cannot be treated easily with acupuncture alone, we will only perform acupuncture on hand Shaoyang, foot Shaoyang, liver, and spleen meridians. That's also why only some symptoms are listed as can be relieved in the beginning of the program. The acupoints we selected include TH2, TH3, GB31, GB41, GB43, LR2, LR3, LR9, SP3, SP6, SP10. You need not use all of them at the beginning, especially when you do acupuncture by yourself. 3 to 5 acupoints may be a good beginning. We recommend starting with TH2, TH3, GB43, LR2, and LR3. You can even start with 3 acupoints on the feet, that is, GB43, LR2, and LR3. Of course, if you choose fewer acupoints, the effect will not be obvious, but it will bring some change. In fact, we have carried out an experiment last year, and the experiment showed that for a patient whose meridian has been hurt recently, acupuncture at 2 acupoints is enough to dredge the Shaoyang meridian. Let's use GB43, LR2, and LR3 as examples to show the locations, needle insertion angles, and depths of these acupoints. GB43 is located between the 4th and 5th toes. LR2 is located between the big toe and the second toe. When needling, insert the needle at a 45-degree angle to depths of 0.3 and 0.5 cm, respectively. LR3 is positioned 1.5 cm away from LR2. Avoid blood vessels and insert the needle perpendicularly to a depth of 0.5 cm. When placing the needle, there is no need to worry about the exact location of the acupoint. Deviations of 2 to 3 mm, or larger distance, are acceptable. Of course, it is more effective when you can pierce at the exact acupoint location, but it is also useful when the needle is placed near it. For other acupoints, you can find related videos and books on the internet to learn by yourself. In addition, you can also press other acupoints on the meridians previously mentioned. If you find painful when pressing an acupoint, the acupoint should also be used. Here are some other important tips. Finally, if you have any questions or needs, contact me at any time. You can also use the link on my Facebook homepage to join our group discussion. I wish you all a speedy recovery.